Welcome back to Pain Diaries. Dr. Suzanne Manzi here in Houston, Texas. And I have Jim LaValle with me today, and we are going to be talking about getting the edge. So Jim, welcome back. I know you have and are currently working with some individual players as well as whole teams in the NBA, NFL, NHL, Major League Baseball, MLS, and even some Olympians, which is amazing. Even the Special Forces and optimization for the elite armed service members. So I wanted to talk to you about how you get these people their edge, because these are the people top of their game. I mean, they're amazing. So what do you do to help them live their best lives?
You know, it's really interesting because I use the same principles on those elite performers that I do for the average person walking into my office that we're working with. So whether you're you're an attorney, you're a doc, you're a teacher, you're blue collar trade. In the end, you have to look at their labs and start to look at, well, where is there an imbalance? Where do I need to improve the chemistry of this individual so that they can recover at their best? A lot of times what happens is when people start to overtrain, you start to see more oxidative stress in their body, and that oxidative stress transmits to less blood flow, and less blood flow means I'm not going to get rid of the lactic acid, and that means I'm going to get sore, and I'm going to start to make more stress hormones that make me less resilient. And so with those individuals, look, using nutrients can be invaluable. There's core things that people need to take no matter who you are. For example, in pain, one of the most simple things with pain is getting adequate magnesium in the body. And, if you don't eat plants, you're not going to get any magnesium. It's real simple. You don't breathe it in the air. It doesn't come on chicken wing sauce. You got to eat some vegetables. And even then, you're not going to probably get enough, especially the more you work out. Got a lot of people going to, Orange Theory. They're taking classes, they're doing HIIT therapies and training. So, you need mag, and magnesium is so important in helping to get rid of lactic acid and help the muscle to be, less stiff. Also helps blood sugar, a whole bunch of different things. Headaches. I mean, one of the main nutrients that's been proven in studies to show it helps with headaches is magnesium.
Wow.
And so I think, right away, I look at magnesium levels, red blood cell magnesium status on people. And I like to find out, hey, where's it at? And are you making a lot of those inflammatory compounds that are making me think, hey, you're loading up on lactic acid. Where's your glucose at? Where's your insulin at? What's your homocysteine levels like? Which is a marker that shows that you're creating more oxidative compounds in your body that's damaging your tissues. And you start to get those in place, and now people can start to feel better because you're starting to get their chemistry to align.
And so when you talk about magnesium, can you just go to the store and buy magnesium, or are you talking about medical grade supplements?
Well, I mean, I like professional grade supplements. I mean, all supplements are food GMP. I mean, the FDA regulates them as food. But what you're looking for are products that have, superior absorption, better salts. You can get a lot of different kinds of magnesium. You can get magnesium carbonate, you can get magnesium oxide. They don't absorb as well. So I'm a big fan of magnesium bisglycinate in general, because you build that up in your tissues good. And so it really absorbs well. Even in the non-absorbers, it's pretty good. And then, of course, there's one called magnesium threonate, which is really good for the nervous system and helps people to sleep better at night. Problem is you don't get enough magnesium if you're trying to build your magnesium pull up. So if you're somebody that has restless legs, you get muscle cramps, your back tends to be tight, you may notice that you're getting a little bit of weight around the waist. Magnesium can even help with that. But the big one is that, magnesium is so important. And yes, you should seek out someone who knows quality magnesium supplementation so that you get a product. If you're going to spend money on something, get something that's going to work. You can get it in a powdered form. You can get it in a capsule form. Either way, it's going to work. You can even take an Epsom salt bath, but that's not going to build your magnesium pull up enough. But they certainly do feel good and help you with those sore, achy muscles.
Absolutely. What about a general multivitamin? Should everybody be on one? What do you think?
Well, I mean, given the way most people eat, Let's put it that way. I mean, I'd love it if people ate healthier, and I know more people are. I'm really happy to see that there are some hopes and glimmers that that's taking place. But because I think food quality is variable when you're trying to eat better, it's probably good to take a multi because there's no guarantee about the food and the quality that the food has.
No, definitely. And again, the medical grade, that's going to be absorbed. It's in a capsule form. Those funny pictures on the internet with the multivitamin and the X-ray that you can see through someone's bowel always makes me laugh. I don't know how real that is, but it's good marketing for medical grade supplements.
Exactly. Exactly.
So, what I've also been, telling patients, our thyroid's not really optimized here in America. And there's always, in order to optimize your thyroid, you need iodine. I wanted to get your thoughts on iodine supplementation for people, because in Japan, as you know, people are getting, up to 15 milligrams a day of iodine, and we're lucky if we get 1 or 2. And yeah, it's in the table salt, but you can't eat that much table salt to even come close, right?
Yeah, it's true. I think it's a fine line on it. You really have to measure your iodine levels because, I've had people that overdo iodine and then it gets them into trouble. So I'm a big fan of, making sure that you get adequate iodine. And I think also, adequate iron, because if you don't have good iron status and you don't make enough ferritin, which is a stored form of iron, you can't make your thyroid hormone actually bind to your cell and give the signal to improve your metabolic rate. So chromium, iron, selenium, alpha lipoic acid actually can be really valuable for thyroid function as well. But obviously the goiter belt. I grew up in Ohio. That was known as the goiter belt. Why? Because we're in the Midwest. Nobody's eating fish, right? Unless it's Mrs. Paul's fish sticks, right? I mean, you're not getting a nice piece of halibut or sea bass. That's not happening. Maybe some carp. But other than that, it's not happening. And I'm not sure if carp's got a lot of iodine anyway. So, so unless it's getting radioactive iodine from the Ohio River. Whoop. But anyway, so yeah, I think iodine's a real important thing for people to get measured to make sure they have enough. Because, it's interesting. People end up, oh, you need thyroid hormone. Well, what they really may need are the building blocks like the amino acid tyrosine and iodine to build their thyroid hormone so that you can make your own. I mean, why not make your own if you can?
Yeah, there's so many different ways. Again, in medicine, like, what do we do? Do we do it naturally? Do we do it with a pill? Or, we borrow it from somebody else?
Right, exactly. Well, what's always been funny is, your body, when you're under a lot of stress, your body kind of turns down your ability to make the thyroid hormone T3, which is the most active thyroid hormone. So a lot of times what happens is they get their thyroid numbers drawn and it's like, oh my gosh, your T4 to T3 conversion is so low. We need to give you T3. It's going to be amazing. You're going to have all kinds of energy. And what's not realized that if you didn't measure cortisol to find out that their cortisol levels are high, and it maybe if they're not sleeping very well. If you don't sleep well, you make something called thyroid binding globulin, and you bind up your thyroid hormone so your free thyroid hormone is not available. Well, now all of a sudden, what I really got is a sleeping and a stress problem. I don't have a low thyroid problem. And so sometimes those folks get the medication and they go, hey, that ramped me up, or I really didn't feel any different from it. And I didn't really lose any weight from it. Why am I taking it? Right. And so it's really trying to dig in and try to go, understand what I call the network biology of the individual, what's connected to what, and how do we start to work on that so that we can, really correct the person's chemistry. Look, at the end, the only goal that I really have when, like, at least when I teach or when I'm in the clinics that I'm with, it's how do we get somebody to feel better? Wouldn't it be great if we just focused on how do we get you to feel better and not just treat numbers? Because I think people appreciate that. They like feeling better.
Yeah, they're like, well, my number's perfect, but I feel like a dog. I mean, let's figure it out and let's make you feel better. That's really what people want. Sometimes they don't care how to get there. They just want to feel better. They need to function. They need to feed their family and go to work and sleep through the night. So,
Well, I always say if I can get somebody to poop better and get a better night's sleep and they lose a few pounds and their mind doesn't feel like they're pushing a thought through jello anymore, their brain gets clearer, they're pretty happy. I mean, I've never seen anybody jump up and down when I've lowered their homocysteine. I was like, wow, cool. What's that mean? So I mean, I can tell them, hey, it's lowering your dementia risk, it's lowering your heart disease risk, it's lowering your kidney disease risk. Oh yeah, that's really cool. But you know what? I'm going to the bathroom every day now, doc. Thank you so much. Right? it's I've unfortunately, I think when you start to get those big levers kind of knocked down for people, then things start to work out for them too.
absolutely. And it's like an onion, right? You just have to chip away layer by layer and figure it out. And once you get to the deeper layers, and then you can really optimize their life and get them what they're really looking for.
Yeah, I really appreciate that you brought that up, because I think a lot of times we look to natural therapies or peptides or compounded prescriptions as if, okay, regular medicine didn't have a miracle. Now I'm going to find the miracle over here. And when I try to get across to folks, if you want good health, it's going to be work, but it's going to be worth it for you because you're going to feel good. And I know with your experience with pain, when people do what you ask them to do, hey, they diet better, maybe they move, they do the exercises that you need them to do in addition to whatever therapies you're applying, and they feel better. That was work for them to get there versus it being something where, hey, take this pill, I'm sure you're going to be fantastic.
Right. And I feel like the more the natural therapies we've been incorporating in our practice, people are becoming more appreciative because they're seeing better results, because we're doing the natural plus the typical pain management things and optimizing them from a hormone perspective as well. Speaking of hormones, vitamin D, that's a great supplement that I'm always trying to kind of emphasize to patients, because they don't really realize it's a hormone, first of all. And second of all, it's an easy way to supplement. People are so low, even being in the sunny state of Texas that we're in, they're just not getting enough, outside vitamin D.
I've given up correlating sunshine to vitamin D because I can't even tell you the last time somebody walked into I've been testing vitamin D for 25 years, probably on a very regular basis. And I honestly can't remember the last time somebody came in at a great vitamin D. Maybe one or two people a year come in and have a good vitamin D and are not taking vitamin D. They either are on it and their readings are decent,
right,
or they're not, and their readings they're terrible. They're incredibly low, below normal, or at the very bottom of the barrel. That one step away from the Grand Canyon bottom of the barrel.
I know, their level's like 30, and that's considered normal somehow.
Right. Yeah, and it's interesting because when you look at all the you go across all the different longitudinal studies, it's you got to get to 55 to get the benefits of vitamin D, and people don't realize how valuable that is. As you said, it's a hormone and it's involved in 4,000 different reactions in your body. I mean, it is a global architect for you waging the war against aging. So I love that you're bringing up the importance of D. I mean, just think of it. 20 years ago, it was revolutionary to give glucosamine.
Yeah, that's pretty
And
amazing.
it started with veterinarians, right? They're giving it to horses and dogs. They're walking around joint pain free, and we're sitting there going, I don't know if it's going to work.
Right.
Tons of studies, of course, over the last 20 plus years. And we found out not only does it lubricate the joints, but long-term use of something like glucosamine turns down inflammatory mediators in your connective tissue. So all those fluids that are floating around in your interstitial space, it's helping to manage all that inflammatory signaling. I think it's fascinating that a lot of these kind of traditional remedies, drinking bone broth, getting collagen, now science at least is pointing the barrel at proving it. And we're seeing that a lot of these things are panning out, that the old historic kind of traditional therapies actually have a rationale to them. And I think it's fantastic,
Absolutely. So. Yeah, we're big proponents of keeping everybody's joints healthy. And I'm happy to, inject a little hyaluronic acid in there too, but let's do it naturally as well. Take your
I'm coming
supplements.
down. I'll take some of
Collagen.
that.
For sure.
That's great. That's great stuff. Yeah, I've had that done.
Yeah, people are happy. They're running around like the horses used to.
Yeah, exactly. Yeah. Well, I got to tell you a real life story. Tore a meniscus about 8 months ago, and it was depressing because I'm running, I'm being healthy and fit, and all of a sudden I come home one night and I see the fluid, the classic meniscus tear fluid going down the lower leg, and I looked it up. What's number one risk factor for tearing a meniscus? And the very first thing that was listed was being over the age of 60, and I kind of heard that wah wah wah.
Oh no.
In my back of my head, right? Because it was just one of those things to realize. But then hyaluronic acid, did some PRP, did some peptides, had somebody inject me, and you know what? I'm back to running, doing great. Didn't need a procedure, just was able to rehabilitate it. And I gotta tell you, I am such a fan of regenerative medicine and the things that you do for people to keep them out of surgery.
It's amazing.
It's phenomenal where that has gone. And being an athlete and someone who's trained at a pretty serious level for a lot of years, actually, I think it's fantastic that we're able to take these types of therapies, combine. There's not enough docs like you that are managing pain by saying, I need you to eat better. Let's optimize your hormones. Because, oh, by the way, at that little tendon ligament bone interface, hormone levels are important for the repair and integrity of them, right?
Exactly.
There's a couple of papers that came out in the last year that really showed that. And I just think it's amazing that, that you're looking at how are we doing all of these things together? Because I know that, patients coming out of your clinic have to be feeling much better because of getting that type of what I just call comprehensive good medicine. I don't like to even put a label on it. Like, oh, it's integrative, it's regenerative, it's functional, it's holistic.
Exactly.
No, it's good medicine.
We're doing comprehensive medicine for our patients.
Yeah, that's it.
People say, oh, you're a pain doctor. I'm like, well, kind of, but I do so much other stuff that's not necessarily under the umbrella of pain to help reduce the pain in indirect ways. So with that, I'm going to say we're going to go back to a commercial break, and when we come back, we're going to talk about our tiny little superheroes, peptides. So we'll be back after a commercial break. This is Pain Diaries. Take care of you so you can take care of business.